Welcome to Sir Robert Chiduk Tutorials. Learning is 24/7. Hello and welcome to Sir Robert Chiduk Tutorials. Today we are going to look at pharmacology. Particularly we are going to look at the type of drugs which are called the angiotensin converting enzyme inhibitors. The angiotensin converting enzyme inhibitors. These are called the angiotensin converting enzyme inhibitors. So I want to go right straight into the topic and find out how these drugs work. The angiotensin converting enzyme inhibitors. So learning here is 24/7. Anytime you can learn, you can go on our YouTube channel, you subscribe and learn a lot. So for you to fully understand how angiotensin converting enzyme inhibitors work, you must firstly understand how the renin angiotensin aldosterone system works, the RAS. So if you go to anatomy and physiology, you look at the renin angiotensin converting enzyme, the renin angiotensin aldosterone system and how it works. Generally, renin angiotensin is there's renin. The renin as an enzyme, it converts angiotensin 1 to angiotensin 2, which is a potential vasoconstrictor, which constricts the blood vessels, thereby causing high blood pressure. Right? So this is what happens under RAS. These are some of the basics of RAS. So I advise you to go and look at the renin angiotensin aldosterone system and how it works. So you must visit the renal system today to fully understand how this system works. Right. What are some of the drugs that fall under the angiotensin converting enzyme inhibitors? So we call these the angiotensin converting enzyme inhibitors. Why? Because they interfere with the activity of the enzyme angiotensin, right? Thereby producing the desired effect, which is to inhibit the activity of the angiotensin converting enzyme, right? So what are some of the drugs that are under this class? Because drugs, we study them according to class, mechanism of action, indications, and so forth. So drugs under this class with benazepryl hydrochloride, it's also under this class. Captopril is also an angiotensin converting enzyme inhibitor. Enalapril maleate with fosinopril sodium with lisinopril. All these are drugs that fall under the same class of angiotensin converting enzyme inhibitors. So if you are to give us drugs that fall under this class, these are some of the drugs that fall under the angiotensin converting enzyme inhibitors: the benazepryl hydrochloride, captopril, enalapril maleate, fosinopril sodium, lisinopril, perindopril, abmine with quinapril hydrochloride, and ramipil. Right? So these are some of the drugs that fall under that class. Now, the most important thing, want to look at what is called the mechanism of action. The mechanism of action. This is how the drug works and how it acts in the human body to produce a desired effect. So now I want to look at the mechanism of action of angiotensin converting enzyme inhibitors, how they work, right? So this is the action. Angiotensin converting enzyme inhibitors prevent conversion of angiotensin 1 to angiotensin 2, a potential vasoconstrictor. So angiotensin 2 is a potential vasoconstrictor, which means it causes peripheral vasoconstriction which leads to high blood pressure, right? So it finds that in some people that have got high blood pressure, it's caused by this potential vasoconstrictor called angiotensin 2. But for that process to happen, it happens under the system that we call the renin-angiotensin aldosterone system, whereby renin converts angiotensin 1 to angiotensin 2, of which the angiotensin 2 is the potential vasoconstrictor. So how does this angiotensin converting enzyme inhibitor works? It prevents the conversion of angiotensin 1 to angiotensin 2. When that happens, we've treated the problem of high blood pressure. Besides decreasing vasoconstriction, and thus reducing peripheral arterial resistance, inhibiting angiotensin, right? So that is how this drug works. So the action 2 is, it also decreases adrenocortical secretion of aldosterone. So this is another action. It decreases the adrenocortical secretion of aldosterone, right? So how does the inhibition of secretion of aldosterone become important? This reduces sodium and water retention and extracellular fluid volume. So when aldosterone secretion is inhibited or blocked, that action reduces sodium electrolytes, it reduces water retention. Why? Because the sodium has got affinity for water molecules. So therefore this sodium, when it is there, it causes water retention, that is increased blood volume, which is one of the factors that increase blood pressure. So adrenocortical secretion of aldosterone is also inhibited, right? That's how it works as well. Then angiotensin converting enzyme inhibition, it also causes increased levels of bradykinin. These are enzymes now. It causes increased level of bradykinin, which results in vasodilation. So bradykinin, these are some of the inflammatory mediators, right? Or enzymes that usually lead to vasodilation. So it causes vasodilation. This decreases heart rate and systemic vascular resistance. So this is another action which decreases the heart rate because of the vasodilation, and also the peripheral vascular resistance is reduced. So that was all on the mechanism of action, or what we call the pharmacological action of a drug. Now let us look at what we call the indications. So the indications, these are different types of conditions which a disease treats. So these drugs that we call the angiotensin converting enzyme inhibitors, they've got a set of conditions which they address or treat. So I want to look at some of the conditions that are treated by using angiotensin converting enzyme inhibitors. So let us take a quick look at those. So we have hypertension. Yes, hypertension is also treated by angiotensin converting enzyme inhibitors, because the angiotensin converting enzyme inhibitors, they inhibit the conversion of angiotensin 1 to angiotensin 2, which is a potential vasoconstrictor that causes hypertension. In heart failure, it's also treated, right? And also left ventricular dysfunction, LVD, MI, which is myocardial infarction, which is treated with ramipril and lisinopril. And then diabetic nephropathy, which is treated by captopril. So these are some of the indications for these drugs. So they are indicated for hypertension, They are indicated for heart failure. They are also indicated for left ventricular dysfunction. They are indicated for myocardial infarction, particularly ramipril and lisinopril. In that case, for myocardial infarction, they are also indicated for diabetic nephropathy, especially with reference to captopril. So these are some of the indications that we have how those drugs work. So now let us look at what we call the adverse effects of a drug. The adverse effects of a drug or the side effects. Right? We say drugs are best medicines in short doses and poisons in large doses. Right? And then at times we find that drugs have got side effects, unwanted effects, right? So the most common adverse effects of therapeutic doses are angioedema. We have angioedema of the face and the limbs, so you should be able to monitor this and see. Dry cough, dyschezia, fatigue, which is general body weakness or exhaustion. We have headache, right? We have hyperkalemia, we have hypotension, we have proteinuria, which is urine which contains some protein. We have rash, we have tachycardia, we have severe hypotension, which may occur at toxic drug levels. So those are some of the side effects that we have. Now, before we look at the contraindications, let me explain something about dose, route, frequency. The dose, route, and frequency, which is about the right dose, right? The time, and also the frequency, which is the duration of treatment. That should be understood. You should refer that one. You should refer to see the right doses, right? You must be very careful about issue of doses. But now you want to look at contraindications. Contraindications. Contraindications, a drug, when we say contraindications of a drug, it means you are not supposed to administer that drug in certain conditions, right? For example, there are certain drugs that are contraindicated for people that have got renal failure. There are some drugs that are contraindicated for people in pregnancy, for people that are breastfeeding. Why? Because there could be some reason they can compromise. They can also even interfere with their health as well. So these are some of the contraindications. So each time we are writing contraindications, your first thing that you should write is that contraindicated in hypersensitivity. Every drug is contraindicated in people that are hypersensitive to that particular drug. So the first contraindication that you should write is to people who are contraindicated to that particular drug, you cannot give. Because the first thing that you ask a person or a patient is to say, is there any drug that causes you to have some reactions? If they say yes, then you know that they are contraindicated that particular drug, so you cannot administer that drug. So in that case, that's a contraindication. A person is contraindicated to that particular drug, right? So it's contraindicated in people that are hypersensitive to the angiotensin converting enzyme inhibitors. Use cautiously in patients with impaired renal function, right? Or serious autoimmune diseases, and in those taking other drugs known to decrease white blood count or immune response. So it also has to be used with extra caution on people with impaired renal function. That is people with renal disorders, right? And also people with autoimmune diseases, right? Autoimmune diseases, these are types of conditions whereby the human body can produce antibodies that fight its own tissues. For example, we've got Hashimoto's disease, amongst others, right? Women of childbearing potential taking angiotensin converting enzyme inhibitors should report suspected, right? So that's another contraindication as well, right? Well, thank you so much for your time that we have had looking at the angiotensin converting enzyme inhibitors. I think you learned well. Let us meet again. Let's link up in the next tutorial where we're going to be looking at different drug classes. Thank you so much.